Welcome to Podcast 83, a regular look at the news, stories, and trends related to Michigan's 83 counties from the Michigan Association of Counties. Brought to you in part by Comcast, bringing the power of the internet into Michigan homes and businesses. Now, here's your host, MAC Executive Director Stephen Curry.
Hi, everyone. Welcome to Podcast 83, the podcast by the Michigan Association of Counties, and we want to thank Comcast for sponsoring this production today. I'm Meghann Keit-Corrion. I'm with the MAC Government Affairs team, and very excited to welcome our guest, Alan Bolter. He is the Associate Director for the Community Mental Health Association of Michigan. Welcome, Alan.
Thank you. Thanks for having me.
Yeah, I talk to Alan very regularly, see him around town, but our first podcast together. So this is exciting here today. Of course, there's a big issue brewing the past, past number of years, but really this past a year and a half with some mental health reform, the Senate proposal on behavioral health integration, some House proposals, and something that our county members have been very engaged on throughout the course of the past year, have seen numerous resolutions around the state, and have worked really closely with you and your organization. And so just wanted to have this podcast today to kind of go over what we've seen over the course of the past year and a half on these different proposals we have in the legislature, and what we kind of think we'll see in the upcoming months and even going into lame duck maybe. So let's first start out on what we've seen come out of the Senate proposals through the majority leader over in the Senate Bills 597 and 598. And why don't you just give us a little bit of the scoop on those claims. We always know there's two, sometimes three sides to every story. So what are some of the groups on the other side really talking about? What do we think, and what do your organization think are really the realities of what those bills would do, and kind of lay the groundwork from there?
Sure. Well, yeah, again, thanks for having me. Really appreciate it. Yeah, I mean, Senate Bills 597, 598 were introduced last summer by Senator Shirkey and Senator Bizon. We hear a lot about the public mental health system, or mental health in general, in Michigan being a broken system that's in need of a lot of changes and reform, and that it, on the Medicaid side of things, which are mostly the individuals that are served through our CMH system, they provide services for people in Medicaid, that it's a siloed system, that you have to go one place to have your services received for physical health, and another place for your mental health services. There's been claims out there that these bills, they don't negatively impact your local CMH, that that locals are afraid to compete with private entities, that should be open up to competition, and frankly, a lot of those just are not the case. The bills, they don't technically eliminate your local CMH, but in reality, they essentially wipe them out as you know them today. So while in the language in the bill, it says that these health plans have to work with or have to have a contract with your local CMH, it does not specify a dollar amount. For instance, the total mental health dollar amount that goes to the overall CMH system is like $3.5 billion. On top of that, there's about $125 million that is general fund, and that's spread across the 46 CMHs. So really, in reality, the only guaranteed amount of money going to your local CMH would be that $125 million general fund amount. The $3.5 billion amount would be totally up to health plans, and essentially making your local CMH just a provider. So whatever they choose to do with them, that would be that part of that piece that they would get. So it's vastly changes how they operate today. Also, the Senate bills totally eliminate any kind of local decision making or local governance, as your members are very well aware, boards of county commissioners make appointments to the local CMHs, and then CMHs make appointments to their PIHP boards. Under the the Senate legislation, all control and decision making is given over to private entities, or there is no local oversight, local decision making, and we've made the argument that many of the care decisions would be made in corporate boardrooms located, many of them are not located here in the state of Michigan. They're in St. Louis, Missouri, or California, or Minnesota, or Arizona. So you would literally have care decisions made for your particular community in another state in a corporate boardroom that frankly isn't open to FOIA, isn't open to Open Meetings Act, and there is no local control whatsoever. You as a county commissioner right now, if you have a problem in your local community, you can pick up the phone, call your CMH director and say, hey, I've got an issue here. I've got a constituent. Can you help me with this? Good luck if that's a private insurance company. And on top of that, the Senate legislation opens it up to right now, we have one CMH, one PIHP. This Senate legislation would open up, you could have as many as 8 of these health plans over a CMH. So, I mean, you would end up, having, commissioners or local elected officials calling basically 1-800 numbers on the back of someone's insurance card to try to get them help. So lots of issues that we see with the Senate legislation.
Yeah, and you mentioned, other states, and I think we've heard arguments that other states have gone to this model, but really, I haven't seen at least, kind of proof that this is actually improving outcomes for those residents, or making it easier for providers, or expanding access. So can you talk about those other states, and are these, is it working anywhere else? Are there models that maybe we need to be looking at that make more sense to improve here in Michigan? But really, where this direction, where's kind of the proof in other areas that this has been working and saving money or providing better care?
Yep. No, I mean, it's, very good questions all the way around, and certainly not new questions, and they continue to be asked. Michigan, I mean, I think as most folks know, is a very unique state as how we do mental health services here, where it is in the Michigan Constitution. In the Michigan Constitution, the state of Michigan then passes that responsibility on to local counties, that they have the responsibility of providing adequate mental health services for their constituents of those particular counties. So in Michigan, we have a county-based mental health system. It's not like that in other states. We also are very unique, where we are a publicly managed state. So it's not a privately managed by an insurance company. It's managed by a public entity. Our PIHP system, our prepaid inpatient health plans, and then through our CMH system. And we're also further unique, where Michigan, our public mental health system is responsible for adults with mental illness, kids with serious emotional disturbances, individuals with substance use disorder, and individuals with intellectual and developmental disabilities. In many states, you have a lot of those different groups are segmented. They're not part of the mental health system, where you have the intellectual and developmental disabilities is in long-term care run by the states. You have substance use disorder, which is in another part, it's in public health or it's someplace else. So we are very unique in that respect. Some of the states that are similar to us, the way we're structured, would be North Carolina and California. Few other states that have now moved in this direction of basically handing the keys over to health plans. And we actually have a study on our website that kind of looks at some of these states. So one of them that I bring up quite frequently with legislators is the state of Iowa. Iowa did this about 5 years ago, where they turned this over to health plans and really have not had very successful results. So last year, or back in 2020, Iowa's Auditor General did a report where they looked at and they surveyed the mental health providers in the state of Iowa, and some of the results that came out of that survey had 51% of the respondents felt that privatization was harmful to quality of care. 54% of respondents felt that privatization was harmful to access to care, And most of the respondents felt that the policies, procedures, or guidelines were more strict under health plans by a 5-to-1 margin. And largely that has to do with denying or delaying coverage or just outright refusing to pay. A couple of the other states that we looked at with similar issues in our study that we did recently would be Arizona, Arkansas, Ohio, and also California have started to move in this direction. So I mean, frankly, that some states, have been doing this for a long time, where they have turned this over to private industry to do this. We would argue the benefit package provided in those other states, what services are provided, what array, whether it's adults, kids, substance use disorder, IDD services, look very different than what it looks like here in Michigan. I think, we have a pretty comprehensive, a pretty robust package, the services that people receive. And we feel pretty strongly if this is turned over, you're going to certainly see a decrease in services. And the quality, I think, will go down quite a bit as well.
Yeah, it's funny you mentioned Iowa. I remember a few years ago being in DC with our partners from the Iowa State Association of County Commissioners, and it seemed like it was a very last minute change to their system, kind of jammed through, and really from their perspective was not something that was working all that well. It was still a new thing, but it didn't seem like it was something that it was well thought out. And I think there were already some questions on whether or not that was maybe the right move, and only the short amount of time that they had done that. So
frankly, there's a lot of empty promises that are made of, basically trust us, we can do this. We do this in other states. And some of it has to do with saving dollars, but it's, well, we do this in other states, so we know how to do this. And a lot of it are just, empty promises that are made. And frankly, with Michigan, with our legislature having term limits, a lot of these things would be implemented, and you would have that group of legislators, they'd be long gone by the time, a lot of the issues would pop up with this. And they're kind of seeing that in some of those other states where, it takes 5-6 years before you really start to see some of the long-term issues. And then it's your provider network is totally eroded. It's, the harm to individuals, has certainly been made. So it's one of those where, you like to kind of trust, but verify before you make this type of decision.
Yeah, absolutely. And I know something that your group's been talking about a lot, and that we hear a lot from our commissioners is, while these bills kind of shift that financial piece and talk about integration from that level, a lot of kind of on the ground and where the rubber meets the road as far as integration at that point of care, is really happening. And there's a lot of good work around, new programs and new federal programs that are being implemented across the state, and things that are really just, working well, and that this could really kind of disrupt that, I think, forward progress that we've seen over the course of the past couple of years. So, I know we have a number of counties that are opposed. Obviously, Maxon opposed the Senate bills, your group, but it's really broad with other groups in opposition. So, just mention a couple of the other groups that I know you guys have been working closely with to make sure that they have been engaged and talking to their legislators as well.
Yeah, we have well over 100 groups that are opposed to the Senate legislation. So MAC, Sheriff's Association, Michigan Catholic Conference, the vast majority of all of the behavioral health or mental health advocacy groups. So the ARC, NAMI of Michigan, all opposed. We have a number of school-based groups that are opposed. Superintendents and other groups like that. We have the NAACP. We have a number of labor organizations that are opposed. So really a wide range, and I think we're up to over 35 different boards of county commissioners have come out in opposition. So counties have done a great job.
specifically to those
rally
Senate
rounds.
bills, but we've
Yes.
also had a lot more that just kind of
Yep.
have opposed general change or large reform to our public mental health system. And so yeah, we've had just a number. We actually did a map, which is all of the different counties that we've seen. And it's almost like the whole state screen at this point.
Yeah, exactly. And we do have
Yeah.
now a number of counties. I know some of the counties, one that I happen to live in Kent County, they do not do non-binding resolutions. So, while I think they strongly oppose that they're not going to pass a resolution because they don't do those type of resolutions. And I suspect probably other counties feel the same way or have the same policy or procedure in place. We also have, probate judges, the Michigan Judges Association. So, I mean, it is a very, broad group. And to go back, Meghann, you mentioned a couple of minutes ago about some of the on the ground initiatives that are taking place. Just very, very briefly, we certainly support integration. We're opposed to privatization. Now we have, as you mentioned, I mean, there's some, a number of programs that our members are part of. They're actually integrating care on the ground where the individual receives services. So we have our CCBHCs, the Certified Behavioral Health Clinics. We have 36 of those sites across the state of Michigan, where they're required to provide 9 essential services. If they do this, essentially, they take anyone that shows up, regardless of insurance. If they provide that level of service, they're able to get additional federal dollars. And we also have over 40 behavioral health home and opioid health homes across the state. So our health homes are essentially the entire Upper Peninsula, the entire northern Michigan region, and then we have a few of them that are downstate as well. And both of those programs have really produced reduced wait times, reduced inpatient readmissions for individuals, have increased individuals, adhering to services that are suggested, and they are both physical and behavioral health services that are provided to those folks. So they're really kind of coordinating at the person level to provide services. And on the CCBHC side, they do jail-based services for veterans. So I mean, it's a lot of really good work that's going on across the state, and we're telling legislators, let's do more of that. Let's focus at that level. And who's paying the bills? That doesn't move the needle on how people access their care or get the care they need.
Yeah, some really, really great points there. So obviously we are in the middle of budget season. I know the legislature is working on additional supplemental spending from the federal dollars. We're, obviously all anxious to get out. It's also a campaign year, our election year, in which there are a lot of new districts. And so, what are you sensing for, expectations for movement during, these kind of next few critical months to get this budget done, to get folks home for the summer. And then of course, we get back after election and we're basically into lame duck season. So where do you think this goes, and what can counties do now, later, to really ensure that they're engaging with their legislature and talking about this issue?
Yeah, honestly, I mean, this is probably going to come down to a lame duck issue. On the Senate side, the bills were on the agenda back in early March, where I think it was the intent of the Senate Majority Leader to move those out of the Senate then. And frankly, he didn't have the votes to move them. And again, I continue to tell our members, he does not have the votes today. That certainly does not mean he will not have the votes tomorrow or the day after. So he certainly has a lot of levers and things at his control where he can, eventually, I believe, move this out of the Michigan Senate. Now, do those bills make it through the House? I mean, that's another question. But right now, I mean, we have probably a month and a half or so, a little more than a month and a half before they, hopefully they break for the summer. I don't know. I guess I don't anticipate the Senate bills moving out of the Senate by then. I'm fully expecting to to deal with this, where things will really heat up probably after the election. During lame duck is when I think we'll really see things intensify around the Senate legislation. I think that's when we're really going to see that big push, and a lot of it's going to come down to deal making and horse trading, and what do I get for this and what do you want for that. So I mean, I think that's kind of what we ultimately, at least what I envision, what's going to happen. So I mean, I think it's we're probably going to be dealing with this right up to about Christmas time. So just depends on what the package under the tree looks like.
Absolutely. Yeah. Well, really quick, just shifting too, because you mentioned obviously the Senate bills may move and get over to the House chamber, but the House has their own ideas, and Representative Whiteford has really taken charge of her own mental health reform package, and has been touring the state the past year and a half, and just before they broke from for their almost current break here, they held testimony in the House Health Policy Committee. There were some changes that were made, but those bills still sit in the committee. I know she wants to move and really get them to a place where there may be some action, again, maybe in lame duck. But can you just do a really quick kind of overview of the CMH perspective on the House package? Any thoughts for that moving, and maybe things that still need to be worked out or improved? And I know we're still kind of evaluating and having conversations with Representative Whiteford, and she's been engaged with our committees here, and so really appreciated her willingness to talk to us and make some changes along the way. But just a quick overview on what's going on in the House.
Yeah, so kind of a 10,000 foot perspective, how the House bills differ from the Senate. So Senate bills essentially privatize the system. They eliminate PIHPs, give all the money over to private insurance companies. The House bills are very different, where they eliminate PIHPs, but then they give control oversight to one statewide entity. So you can maybe call it a one statewide PIHP versus 10. It does not transfer any money over to health plans, does not privatize anything, still keeps CMHs in kind of that central role locally, puts a lot more control, power, responsibility onto the Department of Health and Human Services here at the state level, puts the risk back at the state. So really kind of shifts what's done at the PIHP level, kind of divvies that up between state responsibility and this new statewide entity responsibility. In our position through CMHA, we did not take a position on the House package. We don't support it. We don't oppose it. It's largely, due to, really, Megan, what you talked about with Representative Whiteford being far more open and working with us. She's gone around the state talking to all of our members, from PIHPs to CMHs to providers, and frankly to advocates and family members. So she's really taken some input. Now, with that said, we haven't taken a position. We still have a number of concerns and questions about the House package. Obviously, we have a concern about the elimination of the PIHPs. We do believe that there is value added to that system that will be lost under their elimination under the House bills. Also, one of the questions or concerns we have on the House package would be the handling of CMH as well. It does not eliminate CMHs. It kind of keeps them at that center role. It's unclear if it removes some of their administrative or management functions and gives it to this new entity or not. We would be very opposed to that. Essentially, it would be making a CMH just simply a provider, where they do far more than just provide services locally. They manage local networks of care. They're kind of the community collaborator, convener. They work with the sheriff and schools and homelessness and homeless shelters and various entities within the county government. And then one of the other concerns we have, frankly, and you kind of mentioned it earlier, it seems like we have been up against some kind of redesign since 2016. This constant change is not good and it creates tremendous amount of instability within our public mental health system, from providers to workforce to people served, where 2016, we had Section 298 under the Snyder administration. That was in 3 budgets. Then in 2019, former DHHS Director Robert Gordon came out with this SIP Specialty Integrated Plan proposal. And then and that lasted for about a year. And then last year we had the Senate package and House package. So it's kind of been this 5 or 6 years of constant talk about change. We have some other questions and concerns out there on the House package, hoping to continue to work with Representative Whiteford on that. As far as timing, again, I think this is probably going to be a lame duck issue. Maybe the House votes her bills out of the House before they break, but I don't think that's a certainty right now. I do think that there is a desire of the legislature to do something in this space, but they're not really sure what to do at this point. So if I had to guess, if I was going to kind of hedge my bet one way or another, I would say we're not going to see action on the House bills until lame duck as well. Although it's probably more likely that if we're going to see action on either one of the packages before they break for the summer, it'd be the House package over the Senate.
Yeah, well, thank you for joining us today. I think this has been really great information. Obviously, you guys have been a great resource, and you've had good studies and surveys that we've been able to share with our members as they talk to their legislators in the district and at various events. So really just appreciate all the work and the effort that you've put into this over not only this term, but really for years dealing with all of those different kind of iterations of mental health reform and different attempts to improve the system. So any last thoughts or any last things that you want us to know or share with our members?
Yeah, no, I would just like to again thank Mac, your consistent support of our position on this end has been greatly appreciated. And again, we don't want to see the continued erosion of local control and local decision making, because frankly, at the end of the day, who's ultimately going to be on the hook. It's going to be, counties are going to be the ones that are kind of holding the bag at the end of the day if the Senate bills move forward. So and again, if your members want more information on any of our advocacy pieces that we have out there, go to cmham.org. Under advocacy, we have an advocacy resource page on there. We've got our action alerts and all kinds of information out there that folks can go in and access and utilize locally. And then, they can obviously, feel free to reach out and contact me directly as well. So thank you again, really appreciate it.
Yeah, absolutely. Thank you. And I hope everyone has a really great day. Thanks for listening.
Thank you for listening to today's episode of Podcast 83, brought to you in part by Comcast, bringing the power of the internet into Michigan homes and businesses.